Hi, everybody. I am so glad that you are with us for what is now our second Vital Lessons Town Hall. This is a conversation on mental health, ADHD, and what you need to know. Now, as I said, this is our second Vital Lessons, or our second in our Vital Lessons series with Dr. Vin Gupta. Our first one was about measles. And by the way, if you don't know who I am, I'm Randy Weingarten. I'm the president of the AFT. And what we've been doing now through Share My Lesson is I saw a heart as I said that. Thank you. What we've been doing through Share My Lesson is really trying to bring more and more really important science-based health guidance directly to educators and healthcare workers and public employees and retirees and the communities we serve, meaning those we represent in education, healthcare, and public service, and the retirees and all of our communities. And we're doing this series because, frankly, the federal government is not doing anything of the sort anymore. And we have no idea when something comes out of somebody's mouth, particularly the Secretary of Health and Human Services, whether it's going to be a conspiracy theory or not. And so we felt, and this was actually Vin's idea, that we needed to be out there helping people. And so Vin and we created this, once a month series of on issues that are of real concern to our members. And in fact, as we were doing the measles town hall, I asked the question at the end saying, what else would you like us to cover? And guess what? People said mental health. And why? Because mental health is a crisis in this country. Across the board, we're seeing rising rates of anxiety and depression and ADHD. And we're seeing it in our schools a lot. But we're also seeing it in hospitals and city offices. And frankly, a lot of us are seeing it at home. Teachers are seeing kids in distress. They're trying to hold it all together for their kids, their students. Nurses are dealing with intense burnout. So is frankly everyone else in health, in hospital life and in the health professions. We're about to talk to two doctors. I have doctors in my family. I see it on their faces. My brother-in-law and my sister are both doctors and have been for years. And the aging that I've seen of them because of what's happened in the last few years is just obvious. Public employees are navigating more stress than ever before, often without any support. And meanwhile, and I kind of said this, but I think you've seen it, what are we hearing from the feds? Confusion, inaction, mixed messages, disinformation. Instead of getting clear public health guidance, we got a whole mess of culture wars. And instead of support, we're getting a lot of stigma. And you have seen it like I have. So we launched Vital Lessons because if we're not going to be able to get public health support or science-based guidance from the highest levels in our government, if they're not stepping in, we wanted to do it. And we partnered with Dr. Vin Gupta, who is a pulmonologist and somebody as I am, who is an asthmatic, loves our pulmonologists. So Dr. Gupta is a pulmonologist. He's a public health leader. He's a trusted media voice and was through the pandemic. And he has helped us fill these gaps. And as I said before, we want to give our members what they need: practical, trustworthy health information that's understandable to each and every one of us, that can actually make a difference in our lives and in your work. You make a difference. I'm talking to our members now every single day. Somebody should be making a difference for you. And that's part of what we aim with this series: answering real questions, cutting through noise and misinformation, and focusing on solutions that actually may help. So on mental health, and then I'm going to turn it over to our amazing two doctors and healthcare practitioners right now. Why does mental health matter so much? It's health, full stop. But for too long, it's been treated like an afterthought, something that's whispered about or pushed aside. Or if you have money, you can go to a therapist. But if you don't have money, you can't, or there's not access. Our members, as I said before, see this every day. We know that if our students, our patients, our colleagues, if we know that there's something, some issue, they're not mentally well, something has happened, it's a huge obstacle for them as well as others. It's a huge obstacle for their families. And if we know, and we know if we're not taking care of the people who are doing the work, whether it's teachers or nurses or school staff or public employees, everything breaks down. And then there's all this whispering, and no one is actually dealing with the root cause. Notice I didn't say problem, the root cause. So tonight is just about having an honest conversation backed by science, compassion, and urgency. If we don't take this on, nobody else will. Nobody's going to save us but ourselves. And we're incredibly lucky to be honored or to be joined tonight by two of the most respected voices in public health. I talked about Dr. Gupta already. Many of you have seen him on TV. He helped us hugely during the pandemic in terms of giving us real advice about what to do and not to do and how to try to communicate with people. He is one of the most important leaders in a national conversation on health equity and innovation. And then I'm so honored that Dr. Jerome Adams is with us as well. He is the former Surgeon General during the first Trump administration. He brings deep expertise from his work on the opioid crisis, on maternal health, and on public health. And he is someone who also really helped us during the pandemic. I was saying to them off camera, I'll never forget, Dr. Adams, that one of the first town halls we had, teletown halls, you did with our nurses about what we were seeing in terms of COVID, and your just instincts and the way in which you framed up the issues and the way in which you spoke, people heard the urgency and the compassion and, and the savviness and the brilliance all at the same time. So I'm so delighted to have both you amazing doctors and human beings with us today. And I'm just gonna, start by talking, by letting Vin start the whole conversation, and then I and Vin will actually curate the questions. And for all of you, we need to hear from you. This is not a lecture. This is not like you're back in school. Drop your questions in the chat, share your stories, ask what you need to ask. We're building this series for you and the challenges that you're facing every day. Thank you for what you do, all of you. Please, thank you, particularly in this moment. And I turn it over to you, Vin.
Randy, can't say it enough. Thank you for your leadership. You have to have a visionary leader at the top to want to invest your time and just, which is precious. You have a lot of things going on, but just really the conviction that you bring to this is critical, because if it's not set from the top, none of this works. So thank you, Randy, as always, for just always leading from in front. I want to also thank the former Surgeon General, Dr. Jerome Adams. He's in scrubs because he just came out of the OR, and as well as an anesthesiologist, truly a multi-hat professional and leader. And we're lucky to have you, Jerome. So thank you for being here. I would, to everybody, just to emphasize again why we're doing this. We're building out, and this is going to be omni-channel. We've been doing blogs, we've been doing curricular development. Today's news, tomorrow's lesson, which is available on sharemylesson.com, on a variety of topics. So not just things that are newsy, but issues like youth vaping. We've been trying to build out curriculum that you can then utilize at your leisure to potentially even be your own disseminator of health information, or to be able to disseminate that information in your own communities. And so we're trying to tackle as many topics as possible. We're not trying to overload you, because we know that you have a lot of things going on. You're all very busy people, but we're trying to be as efficient and as strategic as possible to do what Randy just said, provide trusted information, highlighting the nation's experts. And Randy and I are doing this together, obviously with a large team at the American Federation of Teachers. I want to thank that team, Kelly Booz, Kelly Nudrow, many others, that actually makes this possible, allows us to syndicate a lot of this content in the social arena. So Randy, thank you to your broader team. Without them, this would not be certainly would not be possible. And, to all of you, we really want feedback on what other topics you'd like to hear about, and we're going to do our best to build content around that. I'm going to provide just a quick tee up on why we're talking about what we're talking about, although I think it's probably self-evident. Youth mental health, separately ADHD, attention deficit hyperactivity disorder, and related issues. In some fashion, this is something that, especially if you're a parent or if you have, really regardless of your age, this is an issue that in some ways we experience in some fashion every single day. And, certainly with social media, the ways in which we consume information, I say this as a dad to two young boys, I feel like times are unprecedented. When I try to ask my parents for advice, a lot of it doesn't feel like it resonates because they raised us in a very, very different period of time. And so I want to acknowledge the fact that there's a lot of anxiety compounded by some of the current events that Randy talked about. And the goal here is to provide a safe space from trusted leaders like Dr. Adams to talk about issues that matter. I can't think of something more pertinent than youth mental health related issues, because this is, again, something that I think touches all of us in some fashion. And you've all seen the statistics. We've seen the rising rates, unprecedented levels of increased depression, anxiety, suicidal ideation. And, the question here is, what can we do about it? And so I'm going to Dr. Adams, I know he's going to talk about sort of the holistic view here. What's happening? Why is it happening? And then ideally, what can we actually do? How can we leverage resources in our communities to do something about this problem, especially if you or a loved one is battling any of the issues that he's going to talk about? So without further ado, on a platform expertise, Dr. Adams, over to you.
Fantastic. I want to make sure you all can hear me. Can you hear me, Vin?
Perfectly.
Okay, fantastic. Well, thank you, Randy. Thank you, Vin, and to the team at AFT. A little bit about my story. I am the son of two school teachers, so very much appreciate the work that you all do and the challenges that you all are facing. I'm a father of three, two in college and one high schooler, so I am dealing with these issues from a parental point of view as we speak. I'm dealing with social media. I'm dealing with the stresses that kids are under, and without revealing too much, I have a child who has been treated for ADHD in the past. So I also understand the challenges that come with making that decision as to whether or not to medically treat your child. And we're going to talk about that a little bit. I'm the brother-in-law of a current school principal. So my sister-in-law right now, every time we talk, is going through these same challenges and is very glad to have AFT supporting her and the folks who work with her. And I'm a teacher myself. I was in the operating room today, but I work at a medical center. So I have medical students, I have residents. I had a high schooler actually in my OR today who was shadowing. And so I'm seeing how the children, the students that we're working with are changing because of society, because of the stress around them. And so that's why tonight I want to talk to you about something that affects every single one of us, not just as individuals, but as teachers, as nurses, as educational support staff, and as members of our communities. I want to talk to you about mental health, and especially the mental health of young people, and how each of you has the power to make a difference. When a child's mental health suffers, their ability to focus, to learn, and to thrive in school suffers too. Students struggling with anxiety or depression are more likely to miss school, they perform poorly on tests, and they may even drop out altogether. In fact, a recent CDC study found that students experiencing poor mental health were twice as likely to have low academic achievement. So that's why we're here today, because we simply cannot succeed in school or in life if our minds are not well. Let's start with the facts, because the data, the data matters. Anxiety disorders affect over 40 million US adults. That's almost 20% of the population, and they're on the rise amongst young people. Depression will impact 1 in 6 Americans in their lifetime, one of the leading causes of disability worldwide. Suicide is the second leading cause of death for people between the ages of 10 and 34. So I'll just let that sink in for a second. And right now, when I'm not in the operating room, I'm teaching at Purdue University. And sadly, we had a suicide on campus just last week. So I'm seeing this in real time, the impacts of rising suicide rates. And the opioid crisis continues to claim nearly 100,000 lives per year. often linked to underlying mental health conditions like anxiety, depression, and PTSD. So our mental health isn't just a struggle, it's a public crisis, and young people are feeling the pressure now more than ever. So why are we seeing this rise in mental health issues? Well, several factors contribute. As Vin alluded to, there's the pressure of modern society, there's economic stress, there's social media, there's the COVID-19 pandemic, and there's an overall breakdown in community connections. But we shouldn't overlook the role of politics and the media. In today's 24-hour news cycle, and something's always playing, whether it's the radio, the TV, something's always playing around us. We and students are constantly bombarded with sensationalized headlines, with divisive rhetoric, and with a steady stream of doom scrolling that keeps our stress levels sky high. And yet the dysfunction, gridlock, and policy infighting that we see in Washington, D.C. isn't just shaping policy, it's shaping our collective anxiety. When every issue is framed as an existential crisis, a threat to our very lives and our livelihoods, it's no wonder so many feel so overwhelmed. Our fast-paced, high-stress world, combined with a lack of proper mental health support and support for each other, has led to a national crisis. And without getting too political, I mentioned in a recent op-ed that I had out how the current environment is leading to increased housing insecurity, increased job insecurity. You've got over 120,000 people who've lost jobs in the federal government currently. And even if you don't know someone directly, those are the parents of your students. Those may be your spouse. Those may be someone you're related to. And so it's something that I wrote in that op-ed is going to cause increased suicides. It is going to cause increased anxiety and depression. It is going to cause increased domestic violence and increased substance use disorder. I also think it's crucial that we talk about disparities because mental health doesn't affect everyone equally. Studies show that racial and ethnic minorities often have less access to mental health services and are less likely to receive needed care. And when they do, that care is often of lower quality. Language barriers, cultural stigma, and a lack of representation among providers, they all play a role. LGBTQ plus youth face especially high risks. According to the Trevor Project, more than 40% of LGBTQ youth seriously considered suicide in the past year. Transgender and non-binary youth are at even higher risk, and that's simply unacceptable. We have a responsibility to advocate for equity. That means ensuring everyone, regardless of race, ethnicity, gender identity, or sexual orientation, has access to compassionate and culturally competent mental health care. Mental health isn't just about fairness. It's quite simply about saving lives. I also want to share with you a perspective that you might not have expected this evening, but that's that mental health doesn't just impact individuals. It impacts entire economies. Why is that important? Well, because Doge, you're hearing everyone talk about the economy every time you turn on the news. And quite frankly, that drives some people to action, even when suicides don't drive them to action. So a little bit on the economic impacts of mental health or lack of mental health. According to the WHO, the World Health Organization, depression and anxiety cost the global economy over $1 trillion each year in lost productivity. And now that 1 trillion is an important number because that's how much we were supposed to be saved by the Doge efforts. Guess what? We don't need to cut jobs. What we need to do is treat mental health, and we'll save $1 trillion. Here in the United States, mental illness contributes to over $200 billion in lost earnings annual. And that's not just people missing work. It's people dropping out of school, losing jobs, or being unable to reach their full potential. And these problems don't wait until someone graduates. They start now when our young people are students. That's why we need to support mental health now so that our students can thrive in school, in careers, and in life. I also would be remiss if I didn't talk about one of the biggest influences on youth mental health today, social media. Now, social media connects us in amazing ways. And this is something that maybe we'll dig deeper into with Vin. There are pros as well as cons, but it's no doubt that social media creates incredible pressure on our young people. It creates a pressure to be perfect. It creates a pressure to compare to one another. It creates a pressure to keep up. Again, 2 in college, 1 in high school right now. Everyone's talking about the great proms that they had or the great prom dresses. They're talking about which colleges they got accepted to. And that's all you see on these social media feeds. that are increasing the pressure on everyone else to keep up with their colleagues, with their neighbors, with their classmates. And the algorithms are designed to keep you doom scrolling through this content, even when it's hurting your mental health. So what can we encourage our students to do? Well, I think it's important that we encourage them to set limits on their screen time, give themselves time to disconnect and to be present. We need to encourage them to curate their feeds, follow people and pages that inspire them, not stress them out, and unfollow accounts that make them feel less than. We need to encourage, let's see here, a little bit slow here. Okay. We need to encourage them not to compare their behind the scenes lives to someone else's social media highlight reel. And we need to encourage them to use social media to uplift, not to tear down. So I want to talk to you quickly about the role of schools here. We can encourage tiered support systems, expanding mental health services in schools, more counselors, more psychologists, more trained educators in the areas of mental health. We can encourage mental health literacy. I'm a big fan of mental health first aid, encouraging mental health education into our curricula. Now, this is something maybe we'll talk about too. One of the problems, and I know this again, being a teacher, having parents who are teachers and family members who are teachers, one of the challenges is that we always want to put more on your plates, but we never take anything off. So we need to figure out how, as we're integrating mental health education into your curricula, that we're doing it in a way that doesn't create just one more thing for you to have to do and one more thing that's on your plate. Community and family partnerships. We need to engage caregivers and community leaders. And then policy advocacy. We need to call for increased funding for school-based mental health and cross-sector collaboration. You know, I often think about the fact that educators and support staff are often the first responders to student distress. So we must empower them with the training, the time, and the tools to act. One of the things that we were going to talk about tonight and that Vin asked me to cover a little bit is the ADHD explosion and youth treatment strategies. Important to understand that students with ADHD may have trouble paying attention, controlling impulsive behaviors, acting without thinking about the result, or being overly active. Symptoms of ADHD include distractibility, restfulness, forgetfulness, and impulsivity. And what's interesting about that, and we'll talk about this too, I'm sure, is one of the challenges here is I have two boys. And while I told you one of my kids had ADHD, the other two didn't. All of my kids exhibited these symptoms at some point in their lifetimes. But let's understand the trends about ADHD. Diagnoses among children have increased over nearly 40% over the last 20 years. Potential factors include better awareness, so we're diagnosing more people appropriately. Also, overdiagnosis, as I mentioned. Every kid has some symptoms of ADHD at some point in their lives. Misdiagnosis, are we calling ADHD something that's something else? Again, it could be anxiety, it could be depression, it could be problems at home, and we're calling it ADHD and trying to medicate away problems that need to be treated in some other way. And then changing behavioral expectations. Once upon a time, things that we considered normal amongst kids are now considered a disruption, a distraction, something that needs to be medicated. There's also the rise of telehealth and direct-to-consumer models, which are accelerating diagnoses and misdiagnoses and overdiagnoses, and also accelerating people's access to stimulant prescriptions. The risk of overdiagnosis and inequity. We know some children may be misdiagnosed due to trauma, sleep deprivation, behavioral disorders, or problems at home that they're dealing with. Racial disparities exist with ADHD as they do with other mental health issues. White children are more likely to receive diagnosis and treatment. Black and Latino children are chronically underdiagnosed. And stimulant use has been inappropriately normalized. There are risks of dependence with stimulants, of misuse, or of over-reliance. I'll tell you, as a professor at Purdue University, a top college, one of the things we're worried about is students using stimulants as performance-enhancing drugs. It's been normalized, everyone's on it, and now students feel like they have to take Ritalin in order to keep up with their classmates who are taking it and who are able to stay up all night long studying. Beyond medication, it's important that we understand the need for comprehensive treatment approaches. A multimodal treatment is or should be a best practice. So not just giving someone a pill, but behavioral therapy, parent training, classroom accommodations, all can help a student with an ADHD diagnosis. There's a role of educators in identifying and supporting students without over pathologizing normal behavior. And there's the importance of early childhood interventions and trauma-informed care. The earlier we recognize these issues, the earlier we can get them into multimodal treatment and avoid or minimize the reliance on medications, as well as negative problems that occur from lack of diagnosis. So again, what is attention deficit hyperactivity disorder? You can diagnose it medically through, actually, I was going to go into that, but I'll stop here because I think Vin is going to go and take a deeper dive here on these topics. But I want to finish by saying that I really am grateful for the opportunity to talk to you all tonight about the broader issues of mental health. I know ADHD is something that's particularly on your minds. Just as with these broader issues of mental health, we can underdiagnose certain communities, and we can overdiagnose or misdiagnose. And the more that we're informed and the more that we talk about these issues, the better equipped we will be. Finally, I want to hit on a point that Randy brought up earlier on. She mentioned the word stigma. And I often say stigma kills more people than what fentanyl does, because stigma keeps people in the shadows, unwilling to ask for help. It keeps other people from being willing to offer help. And it keeps us from having conversations like the conversation tonight. And so with that, I'll turn it over to Vin to give you a little bit more of a deeper dive on ADHD, and then we'll open it up to questions.
Fantastic. Thank you, Jerome, as always. And I know Kelly is sharing some of these spot polls here. So thank you for your responses with respect to at least the ADHD TM. Jerome pretty much covered everything, which to no surprise, it was comprehensive, and was a fantastic just tee up to hopefully robust Q&A. So please have questions. If you do have questions, we have a few coming in through our chat function. Please do make sure you ask as many as you can. If we can't get to all of them today, we'll be sure to make sure that we follow up in some of the summary materials we'll have at the end. So please know that we'll be responsive. I do want to emphasize what Jerome has said is so spot on in terms of the diagnostic criteria, how we think about who might be on the spectrum of having ADHD. I think now over the last few years, what we've realized is that it's not a binary diagnosis, that either you meet a specific standard set of criteria or you do not, and it's black or white, and that it is indeed a continuum. And, I think what we've realized more than anything else, especially for those of you that might have a loved one who has ADHD, or perhaps you have a diagnosis or have been given a diagnosis and are on medications, what's really critical to realize is that really the field has acknowledged that whereas maybe 15 years ago we had a lot of certainty on perhaps using brain imaging to diagnose ADHD, there was a big theme and motif that perhaps there is just there's something anatomic wrong with your brain that's predisposing to ADHD. That was at least a hypothesis. That no longer is the case. We're not thinking about that. Perhaps there's a quote unquote chemical imbalance or biomarker relating to a genetic abnormality that could be explaining somebody who might be at risk for ADHD. Turns out those were all hypotheses, and we don't actually have any evidence suggesting that there's a clear way to diagnose this with a test that you can actually get, like an image or a blood test. That just doesn't exist. And really the field is moving towards acknowledging that ADHD is a continuum of symptoms, and that sometimes somebody who might display symptoms on one day, on a Monday, may not display symptoms the rest of the week, and that it's very episodic. And so that is really critical to emphasize, because I know Jerome talked about just trends in what we're seeing more broadly across sort of all considerations with mental health. When we think, and if I can actually go to the next slide, what we're seeing when it comes to trends in ADHD diagnoses, as he pointed out, just an enormous spike. We're seeing so much in the way of new diagnoses at a time in which, and I just mentioned this to you, diagnostic criteria have never been more in flux in terms of what do we know and what do we not know. The answer is we feel like we know a lot less from an expertise standpoint when it comes to diagnosing ADHD than we did, say, 15, 20 years ago. And yet now we're seeing a spike in diagnoses. 11.4% of all children in the United States have been given a diagnosis of ADHD. That's an all-time high, almost double what we saw about 10 years ago. In 2012, 23% of all 17-year-olds had that spot diagnosis of ADHD. I thought that was an extraordinary number. And even more extraordinary, 5 million prescriptions for medications like Ritalin or Adderall treatments, common medical treatments for ADHD. That was in 2012. Now we're seeing that number 18 million. And again, I should note that's for the adults. We're seeing a spike in kids in these diagnoses. In adults, it's even greater in terms of the number of adults that are being given a diagnosis. And then certainly because of the rise of virtual care and other services, being given a prescription, it's those that actually are taking medications to treat ADHD. We've never seen these numbers before. So that's really important to keep in mind. In an era in which diagnostic uncertainty exists, and we're really revisiting core assumptions on what might be causing it and how to really think about diagnosis, really actually diagnoses are spiking. And so it's to say, I think this is an important conversation. If you or a loved one has been given this diagnosis, if you have a child at home that has been given this diagnosis, important to keep in mind, one, that we're not saying to revisit that, but we are wanting to make sure that you feel like it's okay to ask questions and to probe on something that might have been, say, a diagnosis rendered a few years ago, and now you're on a medication or a loved one's on a medication, to make sure that that's still the appropriate course of therapy and to ask questions, because we're all learning in real time. To give you a sense, to just go back to this, there's so many, Jerome mentioned this earlier, there's so many different symptoms that we think of when it comes to the various types of ADHD. There's an inattentive type, or there's a hyperactive impulsive type. And you're seeing these symptoms, and some examples of them are here. There's a lot. The point here is not to, as Randy pointed out, to lecture at you. It's just to show you that we thought we knew so much about what to look out for and how to diagnose it. At least 6 of these symptoms have to be present for those under 17 years of age. But there's a lot of flux now. And so in this flux, just keep in mind, how is the research changing? Well, again, diagnoses are spiking just as we feel like we know less and less about what actually constitutes ADHD and how to properly diagnose it. Again, there's no clear dividing line between somebody with ADHD and somebody without it. It is not binary. There is a belief now that it is a continuum, and that is a recognition that is recent. That is not something that I think we've long felt has been a core belief. This is a recent recognition. And and there's a question up here, which I want to make sure that, I think Randy and Jerome, I'd love to get your thoughts on this once we get to Q&A, but on nature versus nurture, and this concept that, is it nature, is your underlying genetics that might be predisposing to something like ADHD, or perhaps, Jerome talked about youth mental health, or is it nurture and the environment around us that might be impacting how we feel and our mood and our irritability and, maybe some of our tendencies. And what we're realizing again, too, as we think about this being episodic, maybe on a Monday you feel a certain way, but the rest of the week, perhaps you're not feeling that way. Environmental changes across the spectrum might actually be helpful in a way that perhaps they were deprioritized in the past, or medication was pursued in favor of really a true focus on environmental changes, making sure that to the extent possible you're minimizing social media and getting exercise, to the extent that family life recognizes that every family has a different situation. The more congenial a family situation can potentially be, we've seen that is strongly linked to an abatement of symptoms. And so, sometimes you can't change the environment around you, and there are factors beyond your control, but we're recognizing this. And I think it's important to know that there's a lot more we don't know than what we do know. And medications, lastly, can often help, but what we're realizing, and this is, we're having an honest conversation here, and I think Jerome and I and Randy's goal here is to help you ask the right questions to your medical providers and to build awareness on what we do and do not know. And I think that's how we rebuild trust too. Medications can help, but what we're seeing is that that the results don't really last over time. And some of the seminal foundational research on the use of Ritalin and Adderall to treat ADHD, yes, there's some short-term improvement, especially say in behavior, and say a child in a school setting that might be impulsive. But whether it helps learning, I think we're questioning whether it actually helps them learn better. And certainly over the course of time, at 3-4 years, long-term therapy of these medications, we're actually seeing there's compelling evidence that using medications versus not using medications in the long term, there potentially is not really a significant difference in terms of outcomes that we look at. And so this is the state of the state. I do want to close on, and this is going to seem like a right turn here, But Jerome mentioned this, and I'll just give this a quick passing, and then I know I want to make sure we have time for plenty of questions. I thought Jerome did an excellent job here talking about strategies on utilization of digital devices. We can't have a conversation on youth mental health, its intersection, and ADHD, its intersections to how we feel, without talking about a healthy use or strategies for healthy use of digital devices. It's just impossible. And so number one, and Jerome did a great job with this, I say I have to work on this as a parent with my young children, which is leading by example. So for all the parents out there, I think we can probably all be better leading by example in our own use of digital devices. Be present. Make sure you're mindful of how you're using your own devices, because then that's going to directly reflect on how your children might be using their devices when they have access to them. Engage in shared activities. I've started playing chess with my 8-year-old online. He likes sometimes to use his iPad, and he has to use it for sometimes school learning and school curriculum. I try to redirect him by playing something that he likes to do, like chess. He loves to do that. Okay, let's do that on his device, so that it's being normed that there's actually things that are okay, to be utilizing, that we want to redirect them towards more productive activities. And of course, encouraging tech-free activities where possible. I know we're all busy and it's easy to say, but especially as the weather gets warmer across the country, critical. And we've actually seen that the less that you utilize digital devices and the more that you're outside, that helps abate or reduce the risk of youth depression or youth anxiety, that there's potentially a go through line there. And then set the tone. I think more than anything else, building comfort to allow for open communication for what your children as they get older are seeing on social media, as Jerome pointed out, so that they can talk about safety, so that they can talk about if they're hurt because they weren't invited to something, that they feel comfortable talking to you about that. And of course, all the things Jerome mentioned that I won't repeat, like limits and on screen time, et cetera. Obviously, really, really critical. Randy, I'm going to kick it back to you. I want to make sure that we have enough time to talk about all the questions that I see coming through, but over to Randy.
Well, and Randy, if you don't mind, there's a couple of questions I wanted to hop on while from the chat that while they were up there. You okay with that jump? If I jump right in, Randy, you're muted, I think, or we can't hear you. Ben, can you hear me?
I can hear you, Jerome. Do you want to maybe?
Randy was trying to switch on her headphones earlier.
So I'll hop in because I saw a question that's a great one, and Vin kind of teed it up perfectly. There was a question about how ADHD presents differently in girls versus boys. And it's important to understand that ADHD often does present very differently based on gender, which is why it's frequently underdiagnosed or misdiagnosed in girls, especially in childhood. Boys are more likely to have the hyperactive, impulsive symptoms that Vin talked about: fidgeting, running and climbing excessively, interrupting, whereas girls often tend to show more inattention symptoms like daydreaming, trouble focusing, disorganization, seeming spacey or distracted rather than disrupted. Girls often try harder to mask their symptoms to fit in socially, which can lead to then mental health issues like depression and anxiety. They may be seen as chatty or overly talkative, but not necessarily disruptive. And emotional dysregulation, low self-esteem, mood swings is more common in girls and may be misattributed to other issues like anxiety or depression. Boys are typically diagnosed earlier because of the hyperactivity disorder. Johnny's running around like crazy. Someone notices it, and they want to get him on some medication to calm him down. Whereas girls are often diagnosed much later, sometimes not until adolescence or adulthood. We actually see a lot of girls diagnosed in college, whereas again, boys are diagnosed in elementary school. And oftentimes girls, after years of struggles with school, with self-esteem or emotional well-being. And so helping young girls get timely and accurate diagnosis is key here. And that's why I really wanted to make sure we jumped on that question in case we run out of time, because that's something that I really want to tune you all into, is to thinking about the girls out there, especially with ADHD symptoms, who we may misattribute. Randy, are you on now?
Yeah, Randy, I
still can't hear Randy. And there was another one that I'll jump in on because I love this one too. It was one of the earlier questions. I think it said, I've heard long-term use of ADHD drugs can lead to microvascular disease, POTS, and how do I advise my family members? I think it's critical that we think about the long-term effects of medication, especially for younger people. This is something that it jumped out to me because, again, I told you one of my children was diagnosed with ADHD, took medications. We were actually concerned that these medications were causing other issues, and eventually weaned that person off. It's important to know that as of current medical consensus, stimulant medications commonly used for ADHD like Adderall, Ritalin, Vyvanse, they don't have a well-established link to microvascular disease or POTS, which is postural orthostatic tachycardia syndrome, for those of you who don't know what POTS is. But there are concerns about cardiovascular and autonomic effects, especially with long-term use. So this is a subject that's still under investigation. Here's what I would say to you. Encourage open dialogue with healthcare providers. People should be empowered to ask about the risk and benefits of their medications, including cardiovascular concerns and long-term safety. These are stimulants. We know they can cause tachycardia. They can increase your blood pressure in the short term. So we shouldn't dismiss those concerns. We should encourage open dialogue. Consider regular monitoring for those on stimulant medication. For those students in particular, periodic checkups, including heart rate, blood pressure, and even potentially ECGs can be especially helpful. Stay informed, not alarmed. Avoid fear-based messaging, because as much as we said that medications may be overprescribed, there are lots of folks out there who do benefit from them, and we don't want people to avoid helpful medications because of fear. Discuss lifestyle support. Sleep, diet, hydration, exercise, stress management all play a role in managing both ADHD and your cardiovascular and autonomic tone and health. So it may be that you're experiencing symptoms from your medications because you're also chugging caffeine, and because you're not getting enough sleep, and because you're not getting enough exercise. And so again, going to this holistic whole health approach can help you even when you're on medications. And then finally, when talking with healthcare providers, ask about non-stimulant options. There are non-stimulant ADHD medications like guanfacine, and one of my children tried some of those non-stimulant medications. And behavioral therapies may also offer other alternatives if you feel like your child or the child of someone you care about is having problems with their stimulant medication. So that was a lot, but I think those are two incredibly important questions that I get a lot from parents and that I've dealt with myself professionally and personally. So I wanted to hit on those while we were waiting for Randy to sort through some of her technical difficulties.
Can you hear me?
Oh, you're
now?
on. Back. You're back.
Oh, good. Oh, it's like at first you don't succeed, try again. So I just want to answer, I think the question also about nurture versus nature is that we have to, as educators, we need your best advice, but we have to, as educators, believe that there's a pathway to nurture, because if we don't, then we are consigning kids to a future that's not good. And so I do think that part of us is trying to, that there has to be a high standard of, if it's, on the issue of if it's nature, there has to be a really, really, really high standard for that. Because if that's the case, what are we doing in terms of schools? So I think that and there's nothing that either of you said today that kind of, in fact, you reinforced my view that, what we're learning is we're learning about what kinds of things can help, what can we do to assist, but you're actually making the case that we need more resources in schools, both in terms of identification as well as in terms of support and help. And the case that I've gotten from both of you today is we need to have more health providers in schools to help us and to help, even though there's a lot of questions about, I think that you've actually made us ask more questions today than maybe we have answered. But but I just wanted to, Vin, you said, can we weigh in as educators on that question? And I just think that I needed not to ignore it, but actually weigh in on it.
Yeah, I mean, so I think it's a great question. I will tell you that when we learned about nature versus nurture in biology, this concept, it was presented in a very binary one or the other. And there were lots that we learned about all the experiments where they tried to determine with twins whether it was nature or whether it was nurture. Well, here's the bottom line: is with almost everything that we have experienced in medicine and in healthcare, it's not either or; it's both.
Yeah.
It may be a strongly genetically determined condition, or it may be a strongly environmentally determined condition. But almost everything we've studied and everything that we've learned about, there is usually a genetic predisposition that combines with environmental factors which cause you to develop or to have problems being treated for a particular disease or risk factor. Now, also important to break down, are we talking about, again, the formation of a problem or the treatment of a problem? And here's why that's important, Randy, because one of the things that I get concerned about when we say nature versus nurture and genetics versus environment is again stigma and blaming and shaming. Quite frankly, and I actually was public about this, so I'm not being political here. I was concerned about RFK's recent statements about autism because they could be construed by many people to have been blaming parents for causing autism in their children when he said that all of these cases are preventable. And I just bring that up as a very recent example because we want to be careful, even as we acknowledge that there are environmental factors, that we understand, and Vin said this earlier, that not everyone has the capability to control the environment around their kids the way that everyone else does. And we don't want to blame and shame people for causing mental health issues, whether it's anxiety or depression or ADHD in their kids. Conversely, if we're talking about treatment, we do want to understand, are there things we can be doing in our environment to improve mental health outcomes at school and at home? And Vin and I hit a lot of those. Social media, controlling social media is important. Exercise is important. Diet is important. The types of things you do to relieve stress. So meditation, cognitive behavioral therapy, all these are things that you can do and include in the environment, which can help alleviate symptoms. And the more that we understand whether it was primarily genetically caused or not, how we can help mitigate symptoms on the back end, I think the better equipped we will be to deal with problems. So that was, again, a long answer to the question, but it's a complicated question. And I think it's important that we discuss the nuance of that question. So we're not blaming and shaming, so that we're not trying to be binary and saying, oh, it's genetics, you're doomed, or, oh, you've got bad parents, but that we're really understanding how we can use genetics to better diagnose people earlier or understand who's at risk, and how we can also better control or adapt the environment to lessen people's risk of developing problems and to improve their chances of recovering from problems. I hope that makes sense.
I think it does. I think what probably we have to do, though, is off of today's webinar, we may have to actually do a one-pager to help people have the language so that they can start, lobbying is not the word, but championing and not feel like they, because I'm hearing both of you say it's a both and. The stigma is intense, and I think that you're right, Dr. Adams. Robert Kennedy did make the stigma worse. I mean, he, the notion of what he said about autism was so reviling to so many people. It kind of stops people in their tracks in terms of what we need to do and how we need to do it, and not having the language to be able to advocate for folks. So, there's a poll up right now about access to counselors and therapists and more training for educators and employers and clearer policies and community support programs. But I do think we need to figure out a kind of language that people feel comfortable with, so that they know how to advocate in a way that they're heard, both parents and educators.
I often say words can build bridges or they can build walls. And
Yeah,
we
exactly.
need to be cognizant of the words that we're using, even and especially when we're well intended.
Right, exactly right. See, I mean, and this is so there are a bunch of questions. I think you answered a couple of them as I was trying to get my buds to work, which is what some of the I wouldn't say myths, but did we answer the question about POTS and
I answered the question about POTS, and I answered the question about boys versus girls.
Good, fantastic. So there's
And we answered nature versus nurture. There was another one in there about executive function. Can you read it? I don't see one about Adderall.
Does the are the non-stimulative medications better? And this is a personal question, so I'm not going to raise the name of the person. One of my kids takes Concerta, was taking Adderall, and it was making him depressed.
So this is a great throwback to the nature versus nurture argument. Is one of these medications better than the other? The answer is no, but. And we hear yes, and it's no, but. And the reason why it's no, but is because everyone metabolizes drugs in a slightly or greatly different way. Everyone is going to have a slightly or greatly different positive outcome from medication A versus medication B, and side effects. And so some people do great on stimulants and have minimal side effects. Other people do horribly on stimulants. And that is why I raised the point earlier that we need to empower patients to talk to their health providers. And if they have a health provider who's not listening to them, to encourage them to seek out additional health, a second opinion or a different health provider, because what works for me or my kids may not work for Vin or his kids. There is no clear, this medication is better than that medication. When they're FDA approved, they're FDA approved. And you really need to have a good relationship with your healthcare provider to determine which one is going to work best for you. Same thing for antidepressants. When you talk about people, 1 in 6 people in their lifetime will have a diagnosis of depression. We know some medications out there are better for you if you smoke. If you smoke, you can take Wellbutrin, and that may help you quit smoking, but it may also cause weight gain. So if you're someone who's already a little on the heavier scale, you may not want to take a medication that's going to cause weight gain. That's an example of, we need to customize what you're getting, the medications you're getting or taking based on your genetics and your reaction to medications. And so the most honest answer I can give you is one is not necessarily better than the other. And that's why it's important that we have access to health providers who can help you make the right choice for you. Vin, would you add anything to that?
I thought it was wonderfully comprehensive, Jerome. And, I want to be mindful of folks. And on the East Coast, we're eating into yours and Randy's dinner time, and everybody on this call as well. So I know we're wrapping up on time here. I do want to just add 2 quick things, and then Randy, kick it over to you to help us close. But first of all, Jerome, thank you. Truly, thank you. Your expertise is just singularly unique, and the way you deliver it is so effective. So thank you for being here. 2 things, just clinical wrap-up points to layer onto what Jerome just said. If you do have questions about non-stimulant options, medication options for ADHD, what are the conditions in which, or situations in which they're typically considered? One is if somebody just doesn't tolerate the stimulant version of the medication. So, we had the question on POTS and Adderall, Ritalin, which sometimes, you want to look out for sort of cold digits at the front of your digits or at the tippy toes of your digits as a sign that, one obvious sign of that microvascular phenomenon that somebody's highlighted in the Q&A. If there is a side effect like that, which is not common, usually there tend to be more GI side effects with the typical Ritalin and Adderall. But if there is a side effect, whatever it is, and you can't tolerate it, then that's when non-stimulant medications like antidepressants could be an option in combination with stimulants. Sometimes that combination of a Ritalin or an Adderall with something like a typical antidepressant like Wellbutrin, that combination can be really powerful. or if, say, somebody has both sides of ADHD and insomnia or anxiety, sometimes docs tend to say, okay, let's try a different approach here. So those are some of the why you would consider something that's non-stimulant. But to Jerome's point, there's so many different considerations here. In the post webinar wrap up that we'll provide, that one pager will make sure that you're armed with the right questions so that you can ask your medical provider if this is relevant to you. And second, lastly, just real quick, I know there's been a few questions about the link between ADHD. Is there a link between ADHD and perimenopause/menopause? I will say in May, we're going to be recruiting some of the nation's best women's health leaders to be having that discussion. Randy with you presiding. But as a tee up to that, the answer is yes, there is a link. And what we do know is that perimenopause, menopause symptoms and transitioning or having sort of that set of symptoms can actually worsen somebody who might have underlying ADHD, because those hormonal fluctuations are strongly correlated to changes and increased severity of ADHD symptoms. So if you feel like that might be you or a loved one, and they might be going through perimenopause at the same time that, say, they got a new diagnosis of ADHD, and no one's talking about perhaps a holistic approach to their care, maybe putting them on hormone supplementation. Again, questions to ask their doctor, your doctor, if that's your specific case. But Randy, I'm going to kick it over to you to close us, and then.
So I would just want to say these are, and I saw this with our conversation about measles as well, and frankly, both to Dr. Gupta and to Dr. Adams. I saw it in virtually every conversation that we had during COVID, which is most questions in medicine are not capable of a simple yes, no, or simple binary answer. The nuance, the understanding of the facts, the understanding of of where medicine is at that moment, the limitations of every remedy, the need to have everything layered, and how the body in sometimes works as a very complex actor. In some ways, by engaging in this, we create more confusion because we're forcing people to actually think and to actually ask questions, which is really hard. But both of you tonight, were so amazing in terms of helping take a really tough issue that we have never actually done ourselves in any of the work we've done about ADHD, about how you confront stigma, the resources we need to have, what trends we're seeing. And I can't thank both of you enough for engaging with us in this conversation. So Dr. Adam, right out of surgery, right in your scrubs, Dr. Gupta, for everything you're doing with us, taking on an issue that our members wanted us to do a seminar on. I just can't thank you enough. And Kelly Booz and the staff at Share My Lesson, thank you very much. And for all who are listening, you hear, we're going to do a one-pager, which may actually be a whole bunch of questions, definitions and questions. So you're armed with ways of framing issues. And so you have some more facts and information at your fingertips. But for tonight, I just want to say, Vin and Jerome, Dr. Gupta, Dr. Adams, Share My Lesson, thank you all, and thank everybody for listening.
Thank you. Really appreciate it.